What is tear gas? Well, tear gas is many different chemical compounds that cause a person to temporarily be unable to function. And this is due to the tear gas causing irritation of the mouth, the nose, the eyes, even the throat, the lungs, and even the skin. Now, according to the CDC, tear gas is also referred to as riot control agents. And as I mentioned, they're chemical compounds. There's more than one that can serve as a riot control agent or tear gas. A couple popular ones are CN, the letters C and N you might have heard of, or CS, the letters C and S, but there are many others as well. Now, how much a person is affected by tear gas really depends on a number of factors. It depends on how much tear gas they come in contact with. It depends on how long they were in contact with the tear gas, how prolonged that exposure was. It also depends on where they were when they were exposed, meaning was the person indoors in a closed environment or outside? All of these things matter, of course, and then the underlying, characteristics of the patient, what underlying conditions they may have, and other things of that nature. The effects of tear gas are usually pretty short-lived. That is 15 to 30 minutes after a person has been removed from the environment in which they were exposed to the tear gas. They've been decontaminated, like they've been cleaned off, their clothes have been removed, and things of that nature. But once again, symptoms can be on the milder side or they can be more severe depending on a number of variables. So let's go through the symptoms that people experience when they are exposed to tear gas. And again, the source for this is cdc.gov. With the eyes, you often get excessive tearing, burning, blurred vision, and even redness of the eyes. With the nose, you can get runny nose, some irritation, even burning or swelling. And with the mouth, people can have burning of the mouth as well, along with irritation, even difficulty swallowing, maybe even drooling. But once again, I told you it's not just the stuff up here. It can go down into the throat, the lungs, even the skin. With the lungs, some people can get chest tightness, coughing, a choking sensation, wheezing, even shortness of breath. And even on the skin, believe it or not, tear gas can cause burns or rashes on the skin. Also, people can get nausea or vomiting. Now, the symptoms can actually be long-lasting if the right scenario exists. So long-lasting exposure to tear gas or exposure to large amounts of tear gas or, tear gas exposure in a closed setting, remember I mentioned that, can have really severe effects, such as actually a person can go blind, believe it or not. A person can develop glaucoma, which is a serious eye condition that can actually lead to blindness. Some people actually can have immediate death due to the chemical burns that happen in their throat and lungs. Chemical burns inside the body are very dangerous potentially. So that is something that can happen. And of course, we know that tear gas can affect the lungs, can actually cause respiratory failure in some people in the right circumstance that could result in death. I hope this information is helpful about tear gas. I'm going to come back and give you information on what to do if you've been exposed to tear gas and things of that nature. Guys, I really want you to be safe out there. Remember, love is the most important thing that we can have for one another. I'm Dr. Jen Caudle. If you are interested in sending stars, you can do so underneath each of my videos if you view them on my page. And once again, I will see you soon.